Taking a live look now at the North Carolina Legislative Building, where the clock is ticking for lawmakers to reach a deal on their annual budget as Medicaid expansion hangs in the balance. The State House and Senate have been bickering over the budget for weeks now, leaving more than 500,000 North Carolinians without insurance for even longer. If lawmakers don't make a deal by August 31st, those thousands of people could have to wait potentially until December to get Medicaid benefits. North Carolina's Secretary of Health and Human Services, Kody Kinsley, joins us now live. Secretary, thank you for joining us here.
It's great to be here.
Last week, House Speaker Tim Moore made it sound like you could still roll out Medicaid expansion by October 1st if they can get this deal, this budget deal, reached by mid-September. Is that accurate? Can you clarify?
So we really need the thumbs up. And look, it doesn't have to be the budget. It could be authority just to give us permission to move forward no later than September 1st for us to do that. We've got 8 more days before then. We need to get that done. My team's going to work every way possible to get this done for North Carolina as soon as possible, but we really need their help in giving us the authority to move forward. Okay,
so essentially that inference there is wrong. If
that would be very hard for us to drive that home. Yes.
Okay. You have called on the state lawmakers to decouple Medicaid expansion from the budget so that you can, as you were just referencing, get that passed. What conversations have you been having with lawmakers as we are now just about a week away from that deadline?
I think we've been trying to communicate that this is a really complex reality for a lot of folks. Medicaid expansion gives 600,000 North Carolinians the coverage that they desperately need to be well and to be working and to support their families. On day one, Medicaid expansion will give coverage to 300,000 North Carolinians. Think about it, being able to cover your costs for your prescriptions, being able to go to the doctor when you don't feel well. And instead, what people are doing now is they're just ignoring those illnesses and they're building up to the point that they end up in the ED, and it's so much more expensive for everyone. This is a smart investment. Let's get this done.
So but what are they saying in response?
Well, what we're hearing is that they're working hard on negotiating the budget. I want them to negotiate the budget. There's things in there like investments for behavioral health, investments in state staff that help keep us all healthy and well that are really important. I hope they're pushing hard on those things, but this doesn't have to be tied to the budget. We can get this decoupled and get this done.
And they're saying it's not going to happen that way?
Well, they're very focused on getting the budget done, but they thought they were going to get the budget done at the end of June, and here we are.
Right. I want to talk to you about COVID. We're seeing an uptick in those numbers. The virus season is coming up. Aside from getting the vaccine, what kind of measures is your department taking to prevent the spread of COVID as we get through that?
I encourage folks to look at our respiratory illness dashboard where we track a number of respiratory illnesses in addition to COVID. COVID is going to be with us like those other diseases for the foreseeable future. It's going to rise and fall. Right now we're seeing a slight rise in COVID cases. The good news is we have the tools to manage COVID so it doesn't manage us. Be vaccinated, have tests on hand, get treatment if you get COVID, test when you don't feel well, and maybe layer up with other things. Some folks may choose to wear a mask, among other things, during periods of surge. Right now, the surge levels are not much higher than where they were about this time last summer.
Could we see schools closing again?
That is not where we need to be. We have the tools to manage COVID, so it doesn't manage us.
It's not looking like that's going to be a solution for you guys. Okay, thank you so much for joining us. And tomorrow, Representative Donnie Lambeth, Vice Chair of the House Health Committee, has agreed to take my questions here live on WRAL at 7 o'clock about this important topic. Thank you so much.
Thank you.